All right. Hello, everyone. Welcome. We're doing a Zoom meeting with everyone involved. I have Dr. Yun here. So what I have going on is I have everyone muted because basically Dr. Yun is going to be doing the speaking. And then he has 5 questions he picked out that were inputted to us that we're going to review and go over. And then, of course, if there's any additional questions, I'll give you the information on how to get that through to us. So Dr. Yun, the floor is yours.
You mean, oh dear, I can talk? Well, I've never done that before. All right. Well, listen, we're going to try to do these on a regular basis. One thing is I used to do this a couple years ago, and I found out that, people like to be able to ask the doctor questions and not have to pay for it, no insurance money or whatever. And it's also a way to educate because I'll tell you, it's very interesting. I was talking to a doctor the other day, and the patient had a stroke in the right eye. And I talked to the patient, and he says, well, they just told me to check in a month or 2. So I called the neurologist. I said, hey, listen, what about trying this? There's some great information on it out there. It's use of a drug, but it's off-label, what it's not normally used for. And I've used it several times, there's a 50-50 chance you can get this vision back. No, we wouldn't do that. I said, why? Because it's not part of the AMA approved guidelines. And it kind of really bugged me that there's a lot of stuff out there, but if it doesn't have the official FDA or AMA approved guidelines, they won't offer it to people, and people are suffering with pain or blindness or stroke or whatever. So just trying to educate, because educated patients really are the ones that do the best with their health. So Joey, you want to ask me the first question, and then I hope I get an A today. You guys are going to grade me.
All right, so the first question that we have that was submitted was, can herbs or sprouts help stabilize sugar spikes? I already put cinnamon in my coffee or eat a tablespoon of Greek yogurt if I get hunger or caffeine shakes. I should clarify fresh herbs out of my garden, such as mint, basil, rosemary, and oregano. What are your thoughts?
All right, can I have more than 2 minutes to answer this? Okay. The first thing I would say is this. Everyone thinks of diabetes and blood sugar. I had a lady come into my office several years ago. John, my diabetes is out of control. Well, why do you say that? Because her blood sugars were 85. I said, that's very, very good. And she said, I can tell because my neuropathy is getting worse and worse and worse. This burning fire in my legs is killing me. I said, you're right. Your diabetes is out of control, because diabetes is a systemic illness. We think because we've controlled the blood sugar that we've treated the problem. And that is absolutely false. So there's type 1 diabetes, which is the diabetes usually in younger people, more of a viral or autoimmune condition. And I'm not going to talk about that aspect. I'm going to talk about type 2, which is 90% of the diabetics out there. And really, that's a problem of insulin resistance. The Center for Disease Control has said for years, doctors need to be getting a fasting insulin level, not a fasting glucose. Insulin is different than glucose. And you can tell 10 years before a patient ever has diabetes if they're going to get it. I want the level between 4 and 5. The scale says anywhere between 3 and 26. Listen, if a person has a fasting insulin level of 26, they're usually already a diabetic. Because the problem in type 2 diabetes is this: insulin resistance. The average person they need just a few units of insulin to get glucose into the cell. I had a person today, their insulin level is 23. He needs 23 units of insulin to get that sugar into the cell. You keep doing that long enough and the pancreas is going to wear out and run out of insulin, and then blood sugars go through the roof and you're a diabetic. So I say that to say this. This lady had a blood sugar of 85 because she was doing some great Chinese herbs. Her daughter was a Chinese herb specialist, and the herbs controlled the sugar perfectly, but the diabetes was still continuing. And so, you know, I like the herbs. You can do all those herbs, all of those things, add cinnamon to the coffee or whatever, and it does lower blood sugar, but it does not lower insulin levels, and that is the key. There's two ways to lower insulin that I know of. First of all, the textbooks of medicine say this: if you want to lower insulin levels, you need 1 gram of protein for every 2.2 pounds of body weight. And I never go over 100 grams of protein a day. That's basic Guyton textbook of medical physiology. 1 gram of protein for every 2.2 pounds of body weight. So if you weigh 150 pounds, you need about 70 grams of protein a day. And that is not considered a high protein diet, even per the American Kidney Foundation. The other way to do it, and I've done this with my patients, I've done it with myself, is fasting. And you can reset those insulin levels within a couple weeks just by fasting. And when I say fasting, I basically say water. No juice, you know, no sugar in my tea or a little cream in my coffee or whatever, but fasting. And that is another way to set insulin receptors. To show you how fast it can work, I have a patient that was on 110 units of insulin a day. Basically, within about 2 days, he was off all his insulin. So you can reset your insulin receptors very quickly. If you want to learn more about fasting and diabetes, you could go to YouTube and just punch in Jason Fong, F-O-N-G, Jason Fong, fasting or diabetes. He's a kidney specialist up in Toronto, Canada. He's done the most research on fasting and diabetes, and I've used his book, The Complete Guide to Fasting, $15 on Amazon. I do not own stock in Amazon. And it really, I tell you, I have more patients that I am just shocked have done fasting, and it really does make a difference in diabetes. But, you know, the herbs are great, but you want to deal with the root cause, which is insulin resistance. So hopefully I answered question number 1. Okay, Joey.
All right. The next one that was submitted to us was, what dietary steps can I take to improve my diabetic condition?
Okay. So really, I'm going to just rehash. Take your body weight, divide by 2.2, and that's how many grams of protein you need. The other thing is, in diets, I'm saying this, like, all right, today, just a few minutes before this, a lady came in and she has, so I want a dietary history. For breakfast, she basically has, I think, steel oats, oatmeal, organic oats, and some fruit, and a biscotti. All right. And for lunch, she will have a tomato sandwich. I think that was on Ezekiel bread. And for dinner, she had pork and beans. So I said, all right, not much protein in oatmeal, biscottis, not a whole lot of protein in bread and tomatoes, and the pork and beans, Well, there was one little piece about this big of ham. I said, you're lucky if you got 5 grams of protein. And so you wonder why your hair is falling out, because you don't even take enough protein to even keep the body going. And, you know, that's why I say to my diabetics, what are you eating? If you need 70 grams of protein a day, you're going to have to get that over the 3 meals you're eating. So for me, I do the Young Protein Shake. There's 30 grams. If you're not going to do that, some days do a two egg omelet. Each egg is 8 grams of protein. So there's 16 grams. For lunch, you like your salad? Great. Stay away from tomatoes. Those are very high. That's a high sugary product. I like the salads, but put on maybe a half a cup of cottage cheese, or maybe 6 ounces of tuna, 8 ounces of tuna, fish, chicken, beef, pork, giraffe, whatever, is 8 ounces of protein. That's 30 grams of protein. 4 ounces would be 15 grams of protein. 1 egg is 8 grams of protein. That's kind of a rule of thumb. So if she had 2 eggs in the morning, there's 16 grams. For lunch, she told me she had 8 ounces of tuna on that salad. Okay, there's 30 grams. And for dinner, she had 4 ounces of a chicken breast. So 15, 16, and 30. You know, she's getting 60 grams of protein a day, and that's pretty close. So, you know, for me, my wife made spaghetti and meatballs the other night. She used a pound of hamburger. Unfortunately, there's 6 of us in the family, so I got 2 ounces of protein. Later on, I made a Young Shake because I need about 90 grams a day. So you need to keep the protein in if you're going to really reduce insulin resistance. If you're a vegetarian, look at the, you know, there's plenty of great books on how much protein's in broccoli and things like that. But if you're a vegetarian, you need to supplement with lysine and methionine, because vegetarian diets are low in methionine and lysine, because vegetables just don't have that much of it. So if you do that, and with lysine, you need about 5 grams a day. And with methionine, I think about 2 grams a day of that should help there. But, you know, you need the protein to reduce insulin resistance, and that's kind of where I'd go. Next question, Joey.
Next question is more medication related. Is it helpful to take metformin 500 milligrams once a day or twice a day?
All right. All right. And I saw something from Life Extension recently talking about if you're pre-diabetic, you want to take in, you know, metformin may be a really good drug to take. I have problems with that because metformin has a lot of side effects. And so I'm really not excited about drugs long-term, but a lot of people are doing it to kind of help reduce insulin resistance. It really doesn't. It does reduce the blood sugar. So it will reduce, you know, blood sugar numbers, but people are coming to me to get off their medicines. But if you're going to do metformin, I'd probably do it twice a day, 500 milligrams morning and night. If you know, but I think talk that over with your doctor. But, you know, listen, the more drugs you're on for diabetes, and this was a great study done by the government years ago, the quicker you die. So, you know, you throw more of these diabetic drugs at people, and it does increase your death rate. In that one study that they did, where they used all the drugs to give diabetics perfect blood sugar numbers, it was a 5-year study. They stopped it after 3 years because so many people dropped dead that ethically they had to do it. Because the drugs have consequences. Next question.
This next one kind of ties in with that. The question that was inputted was, is it advantageous for an insulin dependent who is on a daily evening dose of 40 units, who has uncontrolled diabetes and fluctuating readings, to be taking metformin in addition to the insulin? Insulin resistance and tendency to gain weight around the middle.
Okay, so let's see. How do I answer this question?
Yeah, I mean, it was very specific as far as that one.
So what I would say is I have a number of diabetics who are on insulin and metformin, glipizide, things like that, because the doctors have, I felt they really maxed them out with their insulin, and so they're going to use more and more drugs to help control the blood sugar. So here's how I treat with these patients. I always check the blood sugar before the evening meal. I don't like the blood sugars in the morning. One of the large pharmaceutical companies one day said, John, because I wouldn't prescribe one of their drugs. And the rep said, what if I got our chief pharmacist to come in and spend the day with you and to see how you treat diabetics? I said, sure, bring him in. So he comes in and he sat with me, and I said to the lady who's having terrible blood sugar swings, first of all, I don't care about the blood sugar in the morning. When you fast at night, the body's saying, hey, Mary, it's been about 6 hours since you've eaten. The brain here needs a little bit of glucose. And since you're not eating, we're going to go to the liver and take stored glucose, which is glycogen, and turn it into sugar to get energy. So I'm not interested in how much glycogen you made overnight. So that morning blood sugar is a mixture of glycogen and insulin and glucose. So I like the blood sugar right before the evening meal, where it's just pure glucose, blood sugar, no glycogen. So if you eat lunch at 1 o'clock, check it, wait about 4 hours, 4.5 to 5 hours, and check that blood sugar. And what I found was in this patient, when she gave me those numbers, they weren't too bad. Her morning numbers were 270, 300. Her afternoon numbers were more about 180. So I worked off those as my main numbers and was able to get her out of these blood sugar swings and start to reduce some of her medicine. Then I got her protein level up. And to make a long story short, within about 3 months, I got her off all her insulin, and she was just on some metformin. And I talked to the pharmacist, who's the big wig for this company, and I said, so what did you think? And he said to me, he says, John, really, that's what we should be telling our diabetics. Don't go on that morning blood sugar. There's too many variations. It should be more than one right before the evening meal. And he actually said he'd like to spend another day with me, and he needs to go back over and study his physiology textbooks. So, the idea is, I think, is going not on a morning insulin blood sugar number, but going on the evening, and then, increasing the protein, and then trying to get them off. First thing is off insulin, because insulin says store fats centrally. The doctors are always telling the patient lose weight, but they're on insulin, and insulin says hold on to weight centrally no matter what. So that's kind of my insulin weight gain answer.
Okay. The next question, which was actually the final question, the fifth one, was, can taking apple cider vinegar help with insulin resistance? And are there other ways to address insulin resistance?
Okay. Let me make a note, because I'll say this. Let's see.
Yeah, so apple cider vinegar, if that would, help. and any other ways to address the insulin resistance?
All right, before I go there, let me just say this. I have no trouble with using herbs and all that, anything they want to lower blood sugar. I have no problems with that. I will tell you, and I've told this to most of my patients because I learned from another patient, is black seed oil, I think, works wonders for helping to control blood sugar. 1 or 2, 1 in the morning, 1 at night, seems to work really well for diabetics for helping to control blood sugar. Bitter lemon is another one. Bitter melon is another one. But there's a lot of herbs out there, and I tell my patients, try them. You have nothing to lose. Now, apple cider vinegar in the studies does seem to lower glucose and does seem to lower insulin. But when I looked at the studies, they couldn't give me a number. You know, insulin level was 15, and doing apple cider vinegar for 6 weeks, it dropped to 8 or whatever. But the study did say it did lower insulin. It didn't say how much, but I have no trouble with patients doing apple cider vinegar. But in the study, it did not really give real specifics about the drop, the glucose number changes, the insulin number changes. So you can kind of Google that. I think there's one, it was here, it was this was in diabetes and resident clinical practice. Vinegar consumption can attenuate postprandial glucose and insulin responses. Just Google the effect of vinegar on insulin and glucose. But that study, it didn't give me any exact numbers, so I can't really say that. But it really does come down, diabetes type 2 is an insulin problem. And, you know, years ago, I kept wondering, I would have these patients with great diabetic numbers, but their neuropathy would get worse and worse. And I think you need to think of diabetes as a systemic problem. And just because you've patched one part of the roof doesn't mean you took care of the leaky roof. So, you know, I like all the other stuff. I like the herbs, but diabetes is an out of control disease here in the US. And probably 40% of the population is diabetic or near diabetic. And, you know, do all the little side tricks and all that, but take your weight, divide by 2.2, that's about how much protein you need, and, you know, have your doctor follow your insulin levels. I try to get it down to, for guys to, at an insulin level of 4, girls at an insulin level of 5. And, you know, I think that's why years ago, one of the largest insurance companies in the US came to me and said, John, you are the most successful doctor we have in our network when it comes to getting diabetics off their medicines. If you're a type 1 diabetic, just increasing insulin, just increasing protein, they can usually reduce the amount of insulin they take. So protein really helps with insulin resistance, both type 1 and type 2. So I hope I've answered all the questions well. Joey, can I talk a little bit about, you know, or do you want to talk?
Well, no, I mean, we have time to work with. I mean, those are the 5 questions that were submitted to us. So if there's anything you want to touch on or discuss, you know, now would be a great time.
All right, so basically this, would like for you guys to send in questions, you know, call Marie or whatever. And we wanted to just see about how long some of these things take and kind of get a better idea of way to format. Maybe we, you know, do some question and answer on Zoom or off Zoom. But send in some topics, send in a bunch of questions. And, you know, when are we doing our next Zoom?
We still have to plan it. Right now, as far as questions or ideas, we're having everyone submit them to our website. There's usually a contact email directly on our site. So just go on there. Any ideas or suggestions as well, like we'll definitely accept. But I mean, we are able to get pretty much the majority of people that, submitted that they were going to come. And because of, Nature's Food Patch and certain things, because of the coronavirus, we're not able to be out in the public as much as we used to be. This would probably be ideal for at least the time being till we're able to.
All right. Well, I hope this wasn't a waste of your all's time. Thank you for listening to me. And I'll try next time not to wear the same blue shirt. Remind me, Joey.
Okay,
right.
that'd be appreciated.
All right, I'm going to go home and take my daughter to the pool.
All right, everyone. Thank you, everyone, for tuning in. And again, you can get us through our website with any suggestions, questions, and we'll keep you all in the loop as far as when the next meeting will be, okay?